Hello everyone, this is Dr. Nasser, and in this clip I would like to tell you about sickle cell anemia. Sickle cell anemia patient, they have a mutation in their hemoglobin gene, to be specific, beta hemoglobin gene. Sickle cell can be either homozygous or heterozygous. When it is homozygous, it is referred to as sickle cell disease. When is heterozygous, it's referred to as trait. And usually patients with sickle cell trait, they are asymptomatic most of the time, unless they are exposed to a very low oxygen concentration, hypoxic environment, and that may cause their red blood cell to sickle. And that is going to result in vaso-occlusion and obstruction of some of these small blood vessels wherever they may be, in the spleen, in the brain, in the liver, in the kidneys, and they are going to cause ischemic damage to the tissue. In this case, you can see on the blood smear there are two unique features that you should note. One, of course, is the presence of marked number of target cells, increased number in target cells. And the other one is going to be the presence of these elongated sickle-shaped red blood cells. Now, they don't always are going to look as classic as this one. Sometimes they may look slightly elliptical, but again, an elliptocyte will not have this tapered off end and is going to have a kind of round and smooth round ends and is going to look different than this one. As we go through this smear, we notice that yes, indeed, the target cells are present across the field, and I would personally give this a grade of 3+ target cells, and I do see sickle cells across the fields as well in different shapes and forms. And when you are able to identify the sickle cells as sickle cells rather than elliptocytes, then that can have a diagnostic value for the physicians that there is sickle cell present and the patient is going to have specific symptoms that are associated with sickle cell disease. Again, note the presence of target cells, the presence of elongated red blood cells with tapered off ends, and depending on the stage of the disease, the patient may have polychromasia in there as well. Because you need to realize, and I do see polychromasia on this smear as well, and you would expect the reticulocyte count to be elevated as well. I do see polychromasia in here. I do see a Hal jelly body in here, and perhaps in here and in here. This is an artifact, and this is another cell with polychromasia. And overall, I will report this smear as 3+ target cells. I will make note of Hal jelly bodies, and I will clearly indicate that sickle cells are present in the smear. The hemoglobin mutation that causes sickling is located on hemoglobin beta gene, in which a thymine nucleotide is converted to adenine nucleotide, and that in turn results in changing the code of amino acids in the beta hemoglobin protein, in which on the 6th amino acid, glutamic acid is going to be replaced by valine. And valine and glutamic acids are two amino acids with two different properties. And when it comes to their polarity, when it comes to their net charges, when it comes to their structure, and that is going to cause the hemoglobin to polymerize when certain environmental conditions are met. There are two important environmental conditions that patients with sickle cell should be aware of. One is the oxygen concentration. They will go through sickle cell crisis when they are exposed in hypoxic environment. And two, they have to be very careful about the level of the hydration in their body. If they become dehydrated, dehydration will result in the sickling of the red blood cells. If they are going to be involved in strenuous activity, strenuous sports, they should be very careful about their action, because those activities which can cause the hypoxic tissue environments may cause sickling, and with sickling comes a lot of problem. Imagine that every organ has blood vessels, capillaries, and in those capillaries, these sickle cells are going to cause obstruction. They cause vasoocclusion, and any tissue distal to that occlusion is not going to receive the blood and will go through ischemic death, basically. So target cells are present. Perhaps there is some anisocytosis in here. I would give this smear about 1+ polychromasia, the way that I have seen it in different fields. Sickle cell presence, and this should complete my report for this smear.